Let's jump into our second guest right away here, Dr. David Winter, the medical officer for Baylor Scott White. And Dr. Winter, thank you again for being with us. I know you've been on the program with us here many times. I want to ask you, as we start off here, what the most important thing for people at home to know right now about COVID-19, now that we are 2 full years into the pandemic and going into a third.
Well, indeed, and we're seeing this surge start to come down, but I want to emphasize that hospital census in Baylor Scott White hospitals around the state, it's come down, but it's still high. We are able to do elective cases, that's good, but here's what people find surprising. If you look at folks admitted with serious illness because of COVID, they're hospitalized with COVID, the average age is 42, Jason, and most all those folks are not vaccinated. So clearly the vaccines are making a difference as to whether you're going to get sick and go in the hospital or not.
Yeah, and that's something that it seems like we've been seeing throughout the pandemic ever since vaccines have been available, that most of the hospitalizations and certainly the deaths as well are among the unvaccinated. Dr. Winter, I want to ask you this because we've been getting some questions from people. We've asked people to text in their questions. Several people have asked about masks. If they're fully vaccinated, do they still need to wear a mask right now? I think that a lot of people are hearing that things are getting better and they're just not quite sure what to continue doing there.
Well, it's an important question now because masks clearly work. Last year, I saw no case of influenza, very few cases of COVID in folks who were masking significantly, and no influenza or cold viruses, all that seemed to go away. So they do work. How bad do you need to have them right now? If you're vaccinated in a high-risk area, it's probably still a good idea. We talk about what kind of masks to use. Well, they've talked about the fact very clearly in the country that the N95 and the K95 are the best masks. Other masks also work, but not as well. Some of those, I say, just double up if you're worried about that in a high-risk area. So masks are still important right now. If you're with your family, everybody's been vaccinated, then you're probably okay. If you have older parents or grandparents who have immunocompromised states or are frail, I'd be careful around them. You might want a mask and have them mask around you also. So masks still work. Hopefully we get to where you don't have to wear them as much as we do right now, but masks are still an important part of it, limiting the spread of this coronavirus.
Yeah, just to be clear, none of us likes to wear them, and we do know that there's been a lot of burnout. A lot of people are tired of wearing those masks, but as you say there, Dr. Winter, it still has efficacy in some ways, and it is something that we should still be considering in our daily routines. What are you seeing right now as far as people coming in needing treatment for COVID?
Yeah, now I have a lot of patients who've had COVID the last couple of months, Jason. They've all been vaccinated. And for these folks, almost all those folks have 2, 3, or 4-day illness of head congestion, a cough, little fatigue. Then they get well. So it's a minor illness there. And these folks actually can stay home and do very, very well. We do have some new treatments out, though, for the folks that are frail or immunocompromised. Fortunately, we have a new monoclonal antibody that works, sotrovimab. You'll hear more about that from one of our researchers later. We've got 2 pills out that work. Now, unfortunately, all of these new treatments are in very, very short supply now. So if you're frail, immunocompromised, vulnerable to this virus, I'd be careful. But the vast majority of folks have mild illnesses and can stay home with that.
Any closing thoughts before we move on here, Dr. Winter? I know that you've been on the program with us many times here, and it seems like we always get smarter after you've been here.
Well, a recent report came out I do want to emphasize, Jason, and that says that if you've been fully vaccinated and you come down with a serious illness with COVID, you're 14 times less likely to die. This is what we're looking at the deaths right now. And if you're vaccinated and boosted, you're 97 times less likely to die. So I just want to emphasize the fact that for many folks it's a mild illness, but some folks out there are still dying of this today, and we can prevent that by distancing, masking, washing your hands. Those things still work, Jason.
Boy, those are some extraordinary numbers. A little birdie told me it's your birthday today, so happy birthday, and thank you for taking time out of the special day today to help inform us all.
Thank you, Jason.